We've discussed many voice disorders on this channel over the years: nodules, vocal fold hemorrhage, and muscle tension dysphonia, just to mention a few. Today we're going to add vocal fold cysts to the list. We'll discuss the potential causes as well as diagnosis and treatment. It's interesting stuff. I hope you'll stick around.
Sound check. Check 1, check 2.
Welcome back to Voice Essentials, where everybody sings. My name is Dr. Dan and I'm a contemporary singing voice specialist. It's my job to help you realise the full potential of your singing voice. Standing in the way of that potential can be a myriad of voice disorders, and one such disorder is called a vocal fold cyst. Many vocal pathologies develop because the singer is using their voice in a less than optimal way. But vocal fold cysts typically eventuate for all manner of reasons, not necessarily because of anything the singer did or didn't do. Vocal fold cysts fall into the organic grouping of voice disorders. A vocal fold cyst is a small sac of fluid that can randomly appear. They can be rather deceptive because a mucus retention cyst, for example, will often swell with vocal use and then reduce in size with vocal rest, leaving the voice user believing their voice has healed and recovered. But when the voice is placed under load again, the cyst will swell once more. There are, as I've just hinted at, different types of vocal fold cyst. Dr. Scott McCoy writes, some are small mucus cysts and others derived from the epithelium of the vocal fold cover. The factor common to all cysts, however, is a rigidity of the vocal fold that inhibits normal oscillation. Similar to polyps, voice therapy will not resolve the vocal fold cyst. The only course of action available to the person with a vocal fold cyst is removal via surgery. Here we see Dr. Matthew Broadhurst, a Brisbane-based laryngologist, surgically removing a cyst from the right vocal fold. While voice therapy will not assist in the removal and resolution of a vocal fold cyst, it will most certainly play a major role post-surgery, helping to lessen vocal fold stiffness and potential scarring.
Sound check.
Left untreated, a vocal fold cyst can cause trauma to the opposite vocal fold, which might result in a nodular swelling. A vocal fold cyst, particularly an epithelial cyst, can also rupture, causing a vocal fold sulcus, which Ingo Titzer and Catherine Vertellini Abbott describe as a groove in the vocal fold tissue parallel to the vocal fold margin. So how do you know whether you have a vocal fold cyst? Well, as always, the only voice care professional qualified to diagnose any voice disorder, organic or functional, is an ear, nose and throat doctor. A vocal fold cyst can present similarly to nodules, and Lita Scearce, in her book Manual of Singing Voice Rehabilitation, identifies the vocal qualities of the vocal fold cyst as rough or harsh. She also notes that singers with a vocal fold cyst may experience vocal fatigue, difficulty with high, soft singing, unreliable voice, and the need for increased effort in singing. You'll notice that many of these symptoms are similar to other voice disorders. The only way to determine what you're dealing with is to receive a full voice assessment from your ENT. Once you know what your vocal condition is, you can map out a plan of response with your ENT and other voice care professionals. A shorter video today. I hope you've learned something, and if you've had a vocal fold cyst before, be sure to share your story in the comment sections below so that we can all learn from your experience. I look forward to seeing you all again soon. I'm Dr. Dan. Sing well.